I'm Dr. Wenyu from Huashan Hospital, Fudan University. It's my great honor to talk with Professor Brad King, and he is the leading expert in alopecia areata treatment in the world. And welcome, Professor Brad King, and please say hello to Chinese doctors and Chinese dermatologists and the audience online.
Hello everyone, my name is Brett King, and it really is a profound pleasure to be here with a friend and colleague, Dr. Wu, and to know that many friends in China will hear this conversation that we're about to have. I have had truly a great pleasure in my professional life has been the opportunity to visit China in the last few years on a few occasions, and to meet so many dermatologists who are so deeply interested in the true care of patients who are suffering from skin disease and alopecia areata. And so truly, thank you so much for this opportunity.
Yeah, thank you. Thank you for coming to our interview room. And as we know, you are always the leading PI for the world-approved JAK inhibitor. And you have 3 presentations in this AAD meeting. Can you share the updates for your presentation?
Yeah. So I think it's what's fun about this AAD is that we're seeing really new data for upadacitinib in alopecia areata. A very effective JAK inhibitor. I think 2 years ago, we might have said we had excitement because we took care of patients with alopecia areata, and more is always better. But you might have said, but it's just going to be another JAK inhibitor. And now we have data that says upadacitinib might be special among the JAK inhibitors. We're seeing data for achievement of SALT score less than or equal to 20 in 50% of patients at week 24. With baricitinib, with ritlecitinib, and duruxolitinib, we've never seen 5-0. 5-5. Not at 24 weeks, not at 1 year. And so there's something that seems to be special there. We've also seen data at the meeting for adolescents, that 12 to 17-year-old patient treated with upadacitinib, also with baricitinib. When you treat that younger patient who has a baseline SALT score of 50 to 94, we're seeing efficacy with baricitinib 4 milligrams or upadacitinib close to 80% of patients. 80%? That's almost everybody. It's amazing. Again, just to kind of contextualize all of this, which nobody listening to this needs this context. 4 years ago, we were using tofacitinib off-label.
Yes.
And you were.
We still remember at that time,
And now we're looking at data of 80% of adolescents regrowing their hair. It's amazing, the change. And then other things that are coming. we've seen at the meeting the data for Respeg, aldesleukin,
Okay.
the IL-2.
Yeah, I
Efficacy not even approaching a JAK inhibitor, but also not a JAK inhibitor.
yeah.
I would love to know your impression.
Yeah.
Let's imagine a biologic
Yeah.
with which 20% of patients achieve regrowth at 1 year.
Yeah.
How many patients would elect for the biologic that has no warnings? Let's assume that that treatment, it's not as effective,
Yeah.
no warnings, versus a JAK inhibitor. How many patients out of 10 would say, please, I would prefer a biologic? Is it 1 out of 10, 3 out of 10, 5 out of 10? I'm just curious.
Yeah.
The warnings about JAK inhibitors, do they give you the feeling that patients want a biologic?
I know I feel some patients also it's worry about the
Yes.
like JAK inhibitor the side effect
Yes.
and also if the like the biologics, so it's dependent on the like side effects.
Right.
Yeah.
But the point is,
Yeah.
there's a role, right?
Yeah.
We need
Yeah.
Respeg.
And Respeg.
We need
Yes.
bempikibart.
Yeah.
We need a non-JAK inhibitor
Yeah.
treatment
Yeah.
because, first of all, not everybody succeeds
Yeah.
with a JAK inhibitor.
Yeah.
But some patients don't want
Yeah.
a JAK inhibitor.
Yeah.
We need these alternative therapies.
Yeah. As an option.
Yes.
Yeah. Yeah.
Yep, I couldn't agree more. So I'm excited about everything that is coming, everything that is happening.
Yeah. So yes, that's thank you for the sharing. So I think we are so lucky. We are in the game changer period, and also I think we can use many kind of the new drugs.
Yes.
Yeah.
Can I just put in a word for the work that
Yeah.
you are doing, the work that Jinron is doing, and the work that is coming out that I'm seeing from other colleagues in China
Yeah.
every month
Every month.
in JAD, every month
Yeah.
in JAD or JAMA Dermatology or some high-profile journal, real-world evidence for
Yeah.
JAK inhibitor treatment
Yeah. Real world.
of our patients with alopecia areata.
Yeah.
Some of that, failure of one JAK inhibitor, successful treatment with another JAK inhibitor. Really important work. Just the real-world evidence itself is important.
Yeah.
But if you dig deeper and think about the data that you're putting in the literature a little bit differently, there's really important messages for all of us. And I just want to say it makes me proud.
Thank you.
I feel a little bit like I'm a part of what you are all doing, and it just makes me deeply proud and happy.
Thank you. Because I think because of you introduced the JAK inhibitor in the market in China, and also we know we can use the JAK inhibitor in China. So I think all the here doctors in China, they all thank you for you do everything. Yeah, thank you. Yeah, and also like as a JAK inhibitor is now being used more widely in the world, especially also it's like in China. And the long-term treatment We usually follow a step-by-step approach. First is induction, and the second is consolidation and maintenance. We use a standard-approved dose to quickly control inflammation and help start hair regrowth. Then, once we see good results, and then we can move into consolidation stage. At this point, we keep the same dose for about 3 to 6 months, and to stable the condition and reduce the risk of early relapse. After that, we go to maintenance stage. Here, we adjust the dose based on each patient's situation, so we can maintain the treatment effect while also minimize the long-term risk. So in terms of the doctor-patient combination and the long-term conference management, we focus on 2 core points. First is for informed consent before treatment, and the set realistic expectation. Second, individual follow-up throughout the whole process. Finally, achieve long-term stable therapeutic effect. So this is our experience for use the JAK inhibitor in China, and also we also update the guidelines and the consensus in China right now. Yeah.
Which will be, again, those statements are so important to guide the community, right? There are some who do this a lot. Consensus guidelines are a way, right, to share the vast knowledge of a handful of people with everybody who does it less often. And by doing that together, we kind of create collective knowledge where we are, but also around the world.
Yes. So thank you. So thank you because we saw lots of the guidelines, consensus updates in the world. So you're doing lots of effort. For that. Thank you, and thank you for the great talk and the insightful discussion today. And we really looking forward to in-deep cooperation with you in the future, and also work together to the alopecia areata treatment forward.
Yes.
Thank you so much.
My very sincere pleasure. Thank you.
Yeah.